All right. Thank you so much for joining us today, and welcome to our session 3 on our learning collaborative on addressing barriers to colorectal cancer screening. Today, we will be talking about colorectal cancer screening messaging. And this learning collaborative session is provided to you by the National Center for Health and Public Housing. Next slide. Thank you so much. And this again, in case you're joining us for the first time today, the mission of the National Center for Health and Public Housing is to strengthen the capacity of public housing primary care grantees and other health center grantees by providing a range of training and technical assistance. And also, NCHPH is a project supported by the Health Resources and Services Administration, and is a national training and technical assistance partner that is 100% financed by this grant. The information presented today are those of the author only. Next slide. And then this is just a kind reminder to all participants that this session is being recorded. All participants are muted upon entry, and if your line is not muted, we kindly ask to please mute your line for now. And also throughout today's session, we will be having some questions and poll questions as well. So we encourage you to engage in the chat. Raise your hand if you would like your line to be unmuted. And the slides and the recording link will be sent to you all via email after today's session. And for today's speakers, we have Dr. Jose Leon, who is our Chief Medical Officer here at NCHPH, and myself. My name is Frida Pineda Sandoval, and I am the TTA Manager at NCHPH, and I will be co-facilitating the session today with Dr. Jose Leon. And just to begin, please let us know if you were invited to present at the WHO Assembly about the healthcare needs of your population, what would be your top 2 priorities? So this is just a quick icebreaker question that we would like for you to provide a quick response in the chat, just to, get a brief introduction about what your top priorities are. We'll maybe give like a minute or 2 so you can provide your responses in the chat. So what would be your top 2 priorities, your healthcare needs of your population? Thank you so much, Adriana. We received one response, and Adriana says, making behavioral health more accessible and getting CHW services to be billable. Thank you, Karen. Maternal health care, especially for women of color, and CHW well-being. Excellent. Thank you, Dion. And my apologies if I may mispronounce your name in advance. And she says health education is specific to them and transportation for the patients. Thank you. All right, so I think this is a good start. And now I will pass it on to Dr. Jose Leon, who will be going over the Learning Collaborative expectations.
Thank you, Fide. And thank you so much for participating. This is our 3rd session of this Learning Collaborative. We've learned a lot. And on the first session, we heard from the American Cancer Society about the colorectal cancer screening recommendations. We also, in session 2, we also went over some of the challenges and best practices to increase colorectal cancer screening in the populations that you serve. And I'm very happy to see the priorities that you also mentioned that are priorities that are very important to address: maternal health, mental health, the CSW well-being, and education in general. Preventive services also include health education. And sometimes we don't have the time, we don't have the experience to do it, or we have so many other things that we forget, or we don't have time to offer some preventive messages to our patients. So for this learning collaborative, again, the same expectations. Please remember that this is an interactive activity. The idea is to share experiences, that you have a lot to share with us, and other health centers, other community organizations, federal organizations also want to hear from you. So this is a really good opportunity to just share what we're doing in the communities, the challenges that we have, and how we are solving those challenges. Remember that we have people from different backgrounds. We have clinicians, health educators, CSWs, people who may not be fully familiar with this topic. So let's make sure that we respect these differences. And remember that this is a peer-to-peer learning. The difference between a learning collaborative and a webinar is that a webinar, you have someone who is going to lecture for 45, 50 minutes, whereas the learning collaborative, Fide and I are the facilitators, and because this is just a guide, so you can interact and provide, again, the challenges and any promising practices that you have in the community. So we have some questions. If you got it wrong, don't worry, we are all learning. So let's get started and let's have some fun. So the learning objectives for this learning collaborative session are: first, we are going to discuss the steps for increasing colorectal cancer screening. We are going to analyze a workflow for colorectal cancer screening and how to send reminders, evaluate effective messages to increase colorectal cancer screening, and review effective tools to improve colorectal cancer screening. So before we get started, we have another poll question. For this one, you can either use the poll feature or the chat box, and just let us know whether you have a comprehensive team-based approach for colorectal cancer screening. Simple answers: yes, no, or I don't know. Seems that we have some responses in the chat. And okay, so 62% responded that yes, you have a comprehensive team-based approach. 15% responded no, and about 23% don't know whether they have a comprehensive team-based approach. Thank you so much for participating. And we have the follow-up questions. So do you have, or have you identified, for those who have a team-based approach or who are trying to establish a team-based approach, have you identified a champion to lead the colorectal cancer screening option? Again, yes, no, or I don't know. We have the poll feature that Fide is going to show up in a moment. Responses, Fide? 79% responded that they have someone taking the lead. 14% said no, and 7% said that they don't know. So this is great. I'm very happy to hear that many of these of the health centers participating have someone leading the effort, and they have a team-based approach. This is extremely important because, as we see here, we have different issues. We were talking about some of the challenges that we have, so or the patients have as well, to either send back the colorectal cancer screening test result, or transportation issues. So Molly in the first session mentioned that some clinicians are not fully trained to discuss colorectal cancer screening aspects with patients. So all this is very important, because if we analyze, okay, we are going to establish a screening, a team-based screening, colorectal cancer screening campaign. And the reason is that we have reviewed our quality measure, or the HEDIS measure, and we are not doing so well. The reason is that probably we are not sending, or our patients are not responding to the messages that we're sending, or patients have some fears, some challenges. So let's see what is happening, and based on that, we can go through the PDCA cycle and see what's the issue is, and we can go over and over and see what we can do to address all these issues. Now, remember that when you analyze all these factors, you need to have all this is going to help you to establish the procedures, or the follow-ups that you need to increase your colorectal cancer screening, and making sure that all patients are received, or all patients who are 45 to 75 are ready, or to have either the first colorectal cancer screening test or a follow-up. So remember that this is extremely important. We need to see what is happening in an organization, or we need to analyze patient factors. And then when we have all those, and we have analyzed all these issues, then we can develop a strategy to increase colorectal cancer screening. So these are the steps, and I'm quite sure that all of you are very familiar with the steps when you create a campaign, or when you create an intervention to either increase colorectal cancer screening, or breast cancer screening, or cervical cancer screening, or your diabetes or your hypertension patients, and you have to make a plan. So first, we have to see what the challenges are for the patients, what is happening in the community, why people are not being screened, and then we need to identify a team. A team is not only clinicians, not only the person who is going to lead the effort, but all people that somehow have some kind of interaction with our patients. We're talking about clinicians, health educators, CHWs, and even front desk staff need to be trained, because they are the very first to have communication with patients. Then you need to coordinate the team, and then screen your patients, and then go back and see whether or not you are getting your goals. Remember that Healthy People 2030, the idea is to increase from 57.8% to 68.2%. And the American Cancer Society, the goal is to screen 80% of those who are eligible to get to be screened. Once we have this, we have our strategy, we need to use the PDS cycle. We need to do the ACT plan, do a study. So let's make sure that we start the screening process, we are planning it, we are doing it, and then we need to go back and see whether or not the strategy is working. If the strategy is not working, then we need to go back again and start from the very beginning. So start a new strategy, plan it, and then go to the community and do it. And let's in the next session, you can also go back and see whether or not the new strategy is working. So another poll question. Do you have a reminder workflow to follow up with patients after providing patients with colorectal cancer screening test? Excellent. So to have the results, 65% said yes, 24% said no, and 12% said I don't know. I am happy and I'm very glad to hear that you have a workflow or an algorithm in place. Every time that we have conversations with we have a clinical quality work group, and we have clinician, doctors, nurses, health educators, and all social workers, mental behavioral health specialists. And one of the recommendations and one of the priorities that they mention is that we need more workflows. So for this one in particular, this is just an example. The source is the Chit Lake physicians fecal immunochemical test. And when you call your patient and you send a reminder, let's say that the patient either took the test home or just mail the test to your patient, and you haven't received a response, then you need to send some reminders. And basically, when you are not getting any response, you need to move from any message system that you're using, either the portal or the app or the text messages that you're using, and send a letter. If the test is not returned, let's make sure that we have someone who follow up with the patient, with either the doctor or the person leading the effort, making sure that we get the results back. This is something that the quality improvement coordinator and people who are more familiar with the EHR system and who can document all these responses can take care of, and making sure that you also report this to either HRSA or other organizations that you are working on to oversee your quality assurance and quality improvement measures. This is one message that I found very compelling. We are going to talk about the type of messages that we are going to send to patients, but this is a story of someone who got tested and the test came back positive. However, when the biopsy result was sent to the doctor, the biopsy result showed that the polyp or the mass was not cancer, but we need to consider, and we are going to go over the type of messages that we are planning to send to our patients. And this is a probably 6-minute long video. We are not going to go over the whole slide or the whole video. You are going to have the slides after this session, but this is just an example, and I hope that this is working. So Fidel, let me know.
Unfortunately, I cannot hear it from my end. I don't know if
Okay.
After my third child, I started
Okay.
to notice
now I can.
in just what I call the tummy wuggles. So, foods affected me more than they normally did. And that's when I started to think, something's really wrong, like something's off. And I looked for every reason in the book other than going to see a doctor. For me to talk about my stomach issues or, being bloated and gassy and all that, that's not the kind of discussion you want to have. So I was like, okay, that's a little embarrassing. I don't really want to deal with that. We'll just figure it out. And honestly, my mother was the person who said to me, you need to make an appointment with a gastroenterologist.
Orlina came into our office with symptoms.
At one point, I started to see blood in my stool, and now I'm actually frightened. I said, I'm scared.
I said to her, this could certainly be colitis. This is unlikely to be an infection at this point, but we shouldn't play games with this symptom. And we need to consider you're having an examination of your colon or a colonoscopy.
He just kind of looked at me. He said, okay, I understand, but from everything I can see, you need to do a colonoscopy. We at least need to find out what's going on. And I was like, you're going to do what? You're going to go where? With what? Ooh, like, people are not, no.
She had all of the denial going on. And she said, well, it's not a big deal. It's probably this, it's probably that. And I said, this is not a time to play betting games. This is your life. 10 days later, she called. I'm having bleeding every day. 5 days later, she had her colonoscopy. At the time of her colonoscopy, I found a very large mass in the lower part of her colon.
When I wake up, my doctor was leaning over me, holding my hand and saying, I'm so sorry. You're going to have surgery. We found a huge mass. And I remember saying out loud and crying, I have 3 babies. This can't happen. I have 3 babies.
The surgery was performed at the Washington Hospital Center. The pathologist called me and said, this is a very large tumor. We have not found any cancer. We are stunned.
People say, what you don't know.
So this is a really compelling story, and it does say a lot about what we have heard here. Fears, people not doing the colonoscopy because it's embarrassing, because they don't like it. Remember that in this case, we cannot offer another option but the colonoscopy. But remember that for those who are asymptomatic, we have other options. And then the conversation with the patients, making sure that we find something that a patient is, the reason why a patient needs to do the colonoscopy. We've been talking about motivational interviewing, and we need to find what the patient is looking for, what the goals in her life or his life are. And based on that, we can make recommendations. Remember that the idea is not to cause fear. We are not here to say a patient, oh, well, if you don't do it, colorectal cancer is lethal or you're gonna die. That's not the type of message. That's a negative message. But we need to find, as the doctor was able here to communicate the patient that there are other reasons why we can have symptoms. And so the only way that the patient will know whether they have any polyp or any mass is by being screened. So I really liked the video. It's very, very informative, and at the same time, it's showing the challenges that we have and some of the potential solutions. So moving on, now we have a case study. And we have this patient, a 60-year-old East Indian woman. She's brought to her physical by her husband. Her native language is Hindi, but she speaks and understands English. She stated that she doesn't like to see doctors too often because she doesn't want to be a burden. She tries to take care of most problems herself, plus her husband doesn't want to charge up the health insurance. The patient currently lives with her husband and is unemployed. Her past medical and surgical history are unremarkable, but she reports occasional episodes of constipation. The clinician reviews the chart for colorectal cancer screening history and notices that there isn't a result on file. She encourages the patient to have colorectal cancer screening as part of her routine care because it's long overdue. The patient is hesitant because she doesn't know what colorectal cancer screening is and asks why she was not advised in the past. So this is our patient. And we have some questions here. Today we are not going to breakout rooms. We are going to have all these conversation in this room. But if somebody wants to chime in on this conversation, or if you want to use the chat, or if you want to be unmuted, just let us know. But first, it seems that the patient was not informed and the patient never received any message or recommendation to get screened. So the first question for the group is, what strategies have you used to inform the patients or the patient in advance about the need to get a screen for colorectal cancer? You have a patient, a 60-year-old, never been tested, never been screened, never received any message or any information or health education. So how do you start this when you identify a patient who has never been screened and the patient needs some to start the screening process? Then our next question is, how could the provider in this case have handled this situation differently? What strategies to address health literacy might you include in an action plan for her? And what other cultural competence issues may impact colorectal cancer screening? So anyone would like to, if anyone would like to take, a shot on these questions. So this is the time. We can either use the chat, we can use, you can also be unmuted, and you can chime in on this conversation.
Hi,
Hello.
Dr. Jose Leon.
Yes.
Hi, my name is Kim. Let me
Hi.
put my
Thank
hi.
you so much
I'm gonna
for
put
joining us.
I'm gonna put my camera on. Okay. So I would like to address number 3. We don't
Okay.
need to go in order, correct?
Correct.
Okay. So the first thing that comes to my mind with number 3, we noticed that the patient is unemployed. So her husband, I'm assuming, is the sole breadwinner for the family. And it was also noted that he didn't want her to, or she didn't, one of them didn't want the insurance to be charged up. So that could have a factor in why, not necessarily why it wasn't brought to her attention, the need to be screened, but maybe they're a little hesitant about getting screenings in general. Maybe looking at it like it's not necessary if she hasn't had any other symptoms besides an occasional constipation. That was like the first thing that came to my mind.
Thank you so much for that, Karen. And you are totally right. Those are the biggest concerns, especially when you have a patient who is not fully insured, for instance, and you don't know what the copay will be for this patient. That's a very important issue and one of the reasons why people don't get screened. So thank you. That's wonderful. Thank you so much for participating.
Sure.
So anybody else would like to keep the conversation going, either to chime in again on question number 3 on the very the two questions that we have.
Yeah, Dr. Leon. So we just received a response
Okay.
chat. And this response is by Katie. First, I would verify if the patient would like to have a translator that speaks Hindi. so she can better understand information regarding her health. And 2, provide guidance in colorectal screening and the importance of screening, verify option regarding cost to patient, and speak to patient regarding different options available for free screenings that are available via FPL.
Excellent. Yes, those are really good strategies as well. First, we need to, and we see that this is a patient who is Hindi, and the patient may have some concerns, some cultural concerns. The patient also, even though the patient speaks English, probably because this is not her native language, she's having some issues fully understanding the reason why she needs to get screened. And third is the concern is the health literacy, because you can speak English well and you can be fluent, but we need to also keep in mind that not all patients, regardless of whether or not they speak English, fully understand the medical instructions. Katie is also saying about the federal poverty level, which is also true. And I see that there is a somebody who would like to chime in on this.
Hi, you know, it's just so strange that in the United States we have so many commercials, even the news ensures that colon screening is done or they go to a hospital center. I think that, you know, most of the time with cultural competency, no one wants to feel like they are, you know, an animal in certain doctors' offices. So it's like the patients, you know, want to be seen right away. They don't want to delay in care. You know, going into an office and there's 20 or 50 people in that office, and even if they're not seeing the same physician, it creates like a disillusion and can compromise their care. So I think like, you know, crowding, overpopulating can really impact someone's healthcare because you're hesitant to do so just because of the long wait time. The nurses and the doctors may be frustrated as well. So I think, you know, commercials are very important with health literacy in any language so that there's a general understanding, you know, about bodily issues and what you have to do at a certain point or milestone in your life.
Thank you so much. And that is great. One of the biggest issues when you have a patient, especially if the patient is a foreign patient, is the fear and the stigma. What the clinic or those in the clinic are going to think about this issue. And even though you can have all your team prepared and trained on cultural competency and cultural humility, still the fear is an internal fear. So the patient is the one who is not doing or not going to the clinic or not following the instructions because that's something that she has internally thought. So it is very important that we have a friendly, I would say a friendly face when we have our patients and we explain to our patients. I also think that just by having the husband with her, which may be a cultural issue that we also need to take into consideration, is another problem for this patient. If you have a patient or we have a patient and we believe that the information that we have been trying to communicate is not fully understood by the patient, what we have to do is we have CHWs, health educators, we have materials in other languages, and making sure that the patient keeps reading or keeps receiving the information that they need. Is very important. It's not just like, oh, she came to the clinic, she didn't want to have the test, and therefore, oh, okay, that's not my responsibility. If we are really looking at increasing these screening rates, and if we are looking at the patient as a whole, then we also need to understand the cultural differences and making sure that we do everything that we have uh, for our patients and making sure that the patients get the message. So thank you so much. Do you have any other comments?
We do. And thank you so much to the participants that just recently participated. We do have another response by Katie. And she says, also, you can introduce patient to navigator that can assist patient and assess barriers that patient and help target the patient's needs. This way, the patient can also build a relationship with the patient navigator to be able to target any situation that can keep the patient in completing the colorectal cancer screening needs. There can be many needs: transportation, companion, income, and others.
Excellent.
That's correct, Katie. Thank you.
Thank you, Katie. That's also true. We need to make sure that we address all these issues, that we are able to see the patient and everything that is behind our patient. In reality, sometimes we have our own way to analyze patients, and sometimes in this case, everyone may have some kind of stigma when you address a patient, but identifying any stigma and making sure that you overcome that and you see a patient as a human being, you are going to solve many of these issues with your patients, either because the patient has fears, because the patient has social determinant of health challenges, because the patient doesn't have transportation, as we was mentioned, or the patient is not insured or is not fully insured. So all these things, all those barriers, we need to analyze them and making sure that we address that issue with our patients. So let's move on. So we've been talking about the screening patients who are 45 and older up to 75, and the patient is over the age of 75. That's something that the patient needs to discuss with the clinician, and we need to analyze whether or not the risk or the benefit is more than the risk, and I'm making sure that the patients are receiving the information, right? But sometimes we have a strategy, and the strategy is to send reminders, right? We see the electronic health record of our patient, and we say, hey, this patient hasn't been screened, or it's time for this patient to be screened. And we have different ways to send reminders, either written reminders, we have letters, postcards, emails, or we do it through the portals, or we also have either direct calls, text messages, and pre-recorded messages. In this case, it's more important to have a direct conversation, if possible. It will depend on what your resources are. With patients, everybody likes a human, the human interaction. Sometimes we get reminders either through our emails, and either these reminders go to the junk folder, or we just click on them and send them directly to the trash folder. So if we don't get any of these, let's make sure that we follow up with a phone call, or with other way, another strategy that is more interactive. And we have discussed the use of health educators and CHWs, who are very, very helpful, and they are part of the team-based approach. So in order to understand the type of messages that we want to send to our patients, we need to know what is going to be resonating for that particular audience. It's not the same, and when you send messages to patients with limited English proficiency, it's not going to be the same message if you send it to an Asian American. Or it's not going to be the same message, or probably you will have to address other cultural issues if you are sending a message to an African American. So let's make sure that what we do is we are taking the cultural background of our patient, and at the same time, instead of promoting any fear, we need to have a call to action. All messages, even the messages that we are going to see, we are going to go over some examples here, is not about causing fear, but letting the patient know that there is an alternative, that there is something else that we can do, in addition to this, and we have other tests or screening tests that we can use. So we have some examples here, probably because we are not going to have enough time and not go over all of this. But again, we need to make sure that we tailor the messages to the population that we are sending the message to, and making sure that there are some tactics, right? In the video, we saw some of the perceptions, about the pain, the discomfort, the idea of someone, going and doing a colonoscopy in a very private area. So instead of going on all these and say, patient, this is going to be something terrible if you don't do it, or cancer is if you get diagnosed by for a doctor, and you have colorectal cancer, most of the cases are lethal or fatal. So let's send messages that are addressing the problem where the patient is not being screened, and let's provide some hope. Let's provide some positive messages. So,
Yeah. Dr. Leon, sorry
yes.
to interrupt. So we did receive some additional feedback in the chat.
Okay.
One of our speakers, participants, Adriana Rojas, and she's been mentioning some of the challenges that she has been encountering at her organization. So I was wondering if maybe we could unmute her line so she can elaborate a little bit more and maybe on how they're addressing those challenges.
Okay, perfect.
So I can just what I was saying is, we've thought about texting and we're going to be pursuing that, but we found it difficult because we're limited on what we're allowed to say in the text messages. So we're not allowed to say you're overdue for colorectal cancer screening. And so what we have to do instead is we have to send them a text message and then have them click a link. And then we have to have them kind of verify their identity in a certain way to then be able to give them a more specific message. So it ends up being a little more work intensive in order to do it. And, we know that it'd be ideal to be able to just text patients right away and say, you're overdue for colorectal cancer screening, or, like something like that. But it's just that balance of, trying to figure out and trying to find ways to get a message out to the most people possible. But trying to also make that message effective while also, competing priorities with all the other text campaigns and texting that happens throughout the agency. So it's not a problem that we're not working to overcome. But I think it's important to acknowledge that, a lot of the solutions that are being presented, or the initiatives are all great, and they all come with their challenges that we have to try to figure out how to overcome, especially when so many of them require person power, to send out the letters. Because from our team, and I'm sure this isn't unique, from our clinical team, we can't necessarily ask the care teams to be sending out these postcards and stuff to the number of people who are overdue. And so that's where, we're part of the HRSA grant. And so that's why we've been able to hire 2 community health workers And so just, really looking to go after more funding, which can allow us to hire more community health workers to focus on preventative cancer screenings, so that we'll be able to have, hopefully, right, a team on our population health that does focus on preventative cancer screenings as a whole, so that we can have a more robust and comprehensive approach to tackle all of this.
Thank you so much for your comments and your strategies. I think that those are really good strategies that we need to keep in mind, ideas that we can put in place in case we don't have a plan or we are still working on providing some messages to our patients, or if our strategy is not working. There are several ways to send the messages, and you are totally right, Adriana. May I ask you what state are you in, and the organization that you are with?
Yes, we're a statewide organization in Connecticut with 13 fixed sites throughout the state.
Excellent. Thank you so much. And here we are just talking about one of many challenges that we can have, because we are not only sending messages for those who need colorectal cancer screening, but we need also to review those who need the breast cancer, the prostate cancer.
Exactly.
So it is a very hard
Yep.
and difficult responsibility,
And
but what you're doing is amazing.
thank you. And I will give one plug too for other people on the call. If your health centers aren't using Cologuard yet, we launched that last year, and that's been a really great addition to our offerings. Not only because it's only needed every 3 years, but also because Exact Sciences, who does Cologuard, takes on a pretty intensive reminder outreach to patients through text messages and phone calls. So that was a great way for us to outsource many of those reminder calls for patients who opt for Cologuard. So at least we know that the patients who did opt for Cologuard are getting pretty regular text messages and outreach calls from an actual person from the Cologuard team. So that's been really, really helpful as well.
Excellent. Thank you so much, Adriana, for those comments and those interventions. Thank you so much for sharing that. There are some tested screening messages that we can use. All these are coming from the American Cancer Society and will depend on the issue that the patient may have. One of the reasons why the patient is not being tested, for instance, the case study that we saw specifically with our patient from India, we can send the message that colorectal cancer screening tests don't have to be expensive. There are simple, affordable tests available, and get screened. Call your doctor today. Something as simple as that. Very positive message. Or most health insurance plans cover life-saving preventive tests. Use the health benefits you are paying for to get screened for colorectal cancer. Call your doctor today. If you see all these messages have call to action to go back to the clinic, to the doctor, making sure that they receive the information that they need. There are several messages here. Probably we are not going to go over all these messages, but we are going to share the slides with all of you, making sure that you can use any of these messages. These messages were created by the American Cancer Society, and it can be used by any clinic, free health centers, and adapt the language if this is too long or probably is not fully addressing the need. You can also modify the language. But we have for financial challenge patients, again, some messages. If you see the last two, several colorectal cancer screening options available, and don't have to be expensive, but making sure that we address the main issue or the main reason why the patients are not being screened, and just keep in mind that if we use any message, this message needs to come from a trusted source of information. In this case, all these are from the American Cancer Society, and they have been fully tested. Then there are messages for people. We've been talking about procrastinators and people with low income. Again, all these are coming from the American Cancer Society. There are for procrastinators. There are for African Americans. If you are serving the African American population and you would like to reach out to them, first you need to understand the reason behind why they are not being tested. According to data, some African Americans are not being screened because since they don't have symptoms, they don't see the need to get screened. Others are that they don't truly or they don't fully trust the providers. And so let's make sure that we address all those issues before we send any type of messages to our patients. Same for the Hispanic and Latinos. There is some cultural nuances. We've been talking about many Hispanic with low English proficiency, making sure that we either have someone who can help them help them understand the message and the reason. The literature says that many Latinos, if not most of the Latinos, trust the medical system. So we can take advantage of that and making sure that we recommend and we advise them to get the test. There are several other examples here in Spanish and English that you can also use. And there are also messages for Asian Americans. And if you see highlighted in yellow, the main reason or the leading reason why they don't get screened is because they don't have symptoms. And if they don't have symptoms, they say, I don't need it. I don't need that test. But we also need to communicate the urgency. I mean, it's right now, it's not next year, it's not in 6 months. If you have the time, just make sure that you make an appointment, come to the office. If not, we can also send you the either the Cologuard or the fecal test, or the other one that is the just the blood, the one that you're looking for blood in the feces. So will you have for young adults, I'm sorry, these are messages. Remember that here we have this population that say they are too young and that they don't need it. So let's take a look at this one and let's analyze this one. We only have 2 minutes, but let's go analyze this message. Eat well, work out regularly, don't smoke. What else? You are taking all the right steps to live a healthy lifestyle, but you are missing one step that might be easier than you think. Talk to your doctor to find out if it's time for you to get screened for colorectal cancer screening. 2 quick questions. If you would like to participate either in the chat or if you would like to be unmuted. Why do you think this message work? And what comes to your mind when you are hearing this message? Anyone who would like to take a chance and see whether why you think this is a really good message for young adults, and why do you think that this is something that works for young adults?
One of the things I think if we get young adults in the habit of getting all of their other screenings that are appropriate for their age and get them in the mindset, so when they are of the age like 45 and older, they'll be in the habit. So they'll already have that mindset. Okay, so now it's time for one more screening, and it won't be foreign to them. You know, they'll already be used to taking care of their body outside of just eating well and working out regularly, taking care of their medical needs as well.
Excellent. Thank you so much for that. And you are totally right. If we see our young patient or our younger patients, they are trying to eat well. They see and receive all the information about healthy lifestyles. The number of people smoking has been decreasing for the last few years. So, but they are not used to getting screened. So this is a message, that, hey, you are doing everything right, but there's still something else that you need to do. Get screened. So we are at the top of the hour. I want to be conscious of that. We can keep the conversation going next week. In addition, we are going to have a health center participating, a health center in Florida, who is and they're going to share their experience and the challenges and everything they do to screen their patient for colorectal cancer. So thank you so much for joining us today. Please don't forget that there is a post evaluation survey. And thank you again for participating. This is a great group. And thank you for all you do for your patients. And thank you so much for your service. And happy Easter. Bye.